through the same physiological stressor, we get to watch what happens. And it's created a lot of like neat data from a hair loss perspective. So overall, and there's multiple review articles on this, but essentially it peaks around the 60-day mark. So 60 to 90 days is sort of that peak. If your patient had COVID like 8 months ago and their hair is thinning now, it's probably unrelated, right? It does seem, and when we pool all of these papers together, we're talking about like thousands of patients in these papers now. It is about 60 to 90 days peak after that acute infection for us to see sort of peak hair loss, which is really in alignment with what we've always thought about telogen effluvium. But again, we've not in the past been able to like be so clear and delineate, that people had the stressor. Whereas with COVID, like we know that they had COVID and we know COVID is a stressor. 2 months later, people lose their hair. Now, the range of patients who do experience hair loss is a bit wide. Most papers find approximately 30% experience it. There's one paper that was really getting deep into not just hair loss, but also scalp related symptoms like burning of the scalp or discomfort on brushing. And they found about 70% of patients had some hair loss reported after COVID, and 30% reported scalp sensations when brushing. And that's pretty high, right? Like that's a huge percentage of patients. So even if we like chuck an average between those two review articles and said it's somewhere between 30 and 70% of patients have hair loss with COVID, that's still a pretty significant number of people, especially given how pervasive COVID infections are in the population still, right? That's still a dominant strain that's going around causing upper respiratory tract infections. And so even if only 30% of patients who have COVID have hair loss, that's still a significant number of people with hair loss. Interestingly, the research has gone one step further in 2025, trying to tie, like, again, COVID severity. Can we tell like who's going to get hair loss when they get COVID? And disease severity is not one of the things that we think is contributing. So those inflammatory markers and the sort of measurable change that people have with COVID is not the impetus for the hair loss, or it's not it's not dose dependent. Essentially, like how bad your COVID is not related to the likelihood of you having hair loss. Again, like I said earlier, if there's a lag there and patients had a mild COVID infection, we may easily skip over that as a potential trigger. But you don't have to have like terrible COVID to also have hair loss. You could have mild COVID and have hair loss. So that's kind of interesting. They also were looking specifically at iron deficiency and whether or not there was something that was also related to hair loss that may have worsened or increased the risk of hair loss when you have COVID. And so, in patients who have like iron deficiency or lower serum ferritin at baseline when they get COVID, they were a little bit more likely to experience hair loss when they had their COVID. And I think that's a really interesting piece. I mean, testing ferritin when people have an active infection with COVID is brutal because it's going to be elevated. And actually, even in the study group, the difference between the low ferritin group and the high ferritin group was still like better than average ferritin. And it's because they were sick, right? So ferritin being an inflammatory marker, it was elevated in all the COVID patients, but the COVID patients who had a ferritin like below 70 were at a higher risk of having hair loss, whereas the patients whose ferritin was like 120, they had a lower risk of hair loss. And what that probably speaks to is that in a non-inflamed situation, the low iron group probably had lower ferritin than is desirable for hair, right? Like maybe below 50, whereas the control group probably had normal hair or normal ferritin, but we tested them in a inflamed state or in a acute infection. And so we get these like kind of inflated numbers. But the big thing to take home here is that it was double, like the ferritin was twice as high in the group that didn't lose their hair versus the group that did lose their hair. So interesting, right?